Welcome back, everyone. Chronic pain drastically affects quality of life for sufferers and those close to them, but there is help. Joining me now is Dr. Paul Lynch and Dr. Tori McJunkin from Arizona Pain Specialists and patient Jeff Brigham. Jeff, welcome to the show. We're going to ask you about your story in just a minute. Now, you guys have just expanded like crazy, but tell us, why did you expand? It's obviously because you're doing things different.
You know, we've tried to approach the patient with a comprehensive model that Dr. McJunkin and I think is the right model for patients in pain. We work with chiropractors, physical therapists. We now have an in-house procedure center in both Scottsdale and Glendale, and we even have in-house imaging. We think that model has allowed us to grow. We have 3 locations now, one in Glendale, Scottsdale, and even in Fountain Hills.
So what's the new technology you have? You call it the pacemaker for pain.
Yep, that's exactly right. So we're actually launching several different research studies on this, but that's correct. It's the pacemaker for pain management, and it basically stops pain impulses as they travel through the spinal cord and go up to the brain. And instead of perceiving your normal pain, you feel a tingling or a buzzing sensation. And we brought a patient to talk about that experience that he's had with that.
Now that's Jeff. Now Jeff, when they said pacemaker for pain, what did you think?
Well, it was a new idea to me. I have heard of it, but nobody followed through on it. But these gentlemen did.
And once you had it done, what was the difference?
About 90%.
90%?
90%, drastically.
What were you feeling before?
Just constant pain and moving the wrong way. You'd have sharp sticks down your legs. And this machine had you just put it in and you can adjust it. The battery pack's underneath your skin. You charge it for an hour and a half every week and you're good to go.
And that's the device right there. How can people learn about this?
Well, I think one of the great things about it is that, you know, we always hear in the news these days about pain management. It always seems to be something negative, someone overdosing on medicine or doctors writing crazy doses of meds. And what we found with this technology is we can actually get patients completely off medications. They're not dependent on these drugs that they're taking that causes side effects like sleepiness and sedation. We basically put small electrodes into the spinal canal.
That's my next question. Where does that go exactly?
We can do it all through a hollow needle. This can actually be done as an outpatient procedure, and patients go home the same day, and they have control over it. They can turn it on or off and basically block the pain from getting to their brain. It's very exciting technology. Dr. McJunkin and I are actually doing 6 different studies on this right now.
And you regularly do studies in your office.
That's correct. So one of the wonderful things about it, too, is you get to do what's called a trial first, and you try it out first try before you buy, but before the surgery, before the battery is implanted, you try it out and see if the device will work for you. So just like you would have an epidural in an outpatient setting, you have an epidural, these small leads go to the place where we think will stop your pain. We turn it on, and then you get to see for the next 3 to 5 days if it really works for you.
Now, Jeff, you said it cut your pain 90%. What about those people out there who said, you know what, I've tried everything. Is this just another one of those things?
Well, I've been doing this I was in a severe car accident in 1989, and I have been to some of the best pain clinics supposedly around the world. I'm originally from Boston. And I came out here, I researched them, and went to see them, told me about it. I said, let's give it a shot, and it's worth every bit. It's a matter of an hour and a half having them put it in, and it's worth it. It's an hour, just charge it up.
How soon after did you start to feel relief?
The next day.
The next day?
Yeah, immediately, because there's 6 different settings. I can turn up and down as I please. And like I said, charge it up for an hour and a half. Set a time aside for an hour and a half while you're watching TV.
That is a dramatic story, but are you hearing this on a regular basis?
We hear it all the time, and what's really exciting, and this is the message that we'd really want patients to hear, is when this technology was first invented back in the 1960s, it was primarily for one diagnosis, people who had back surgery and didn't get any better, and actually their pain maybe got worse. They weren't a candidate for more back surgery. That's when we first started doing those. And we still do about 50% of our cases is for that diagnosis, people who've had back surgery. But now we realize almost any pain in the body, wherever it is, your hand, your foot, your knee, even in the pelvis, we've found ways to do spinal cord stimulations for that. And we're doing studies on almost all those areas I mentioned.
That seems terrific and not that invasive. Now, how can people get in touch with you guys if this is something that they think they want to consider?
Great question. I think the first thing to do is to make an appointment and come in to see one of the doctors at our office. We have now 4 doctors. There's 2 doctors, Paul and myself in Scottsdale, and there's 2 doctors in Glendale. They make an appointment. We always start with the least invasive thing first, but this is an option that can give people long-term pain relief, and we'll discuss all the options with you on your new patient visit.
Are the procedures performed at all the different offices?
They are, and our new doctors, Dr. John Carlson and Dr. Patrick Hogan in Glendale, have been doing this, trained at 2 of the top programs in the country. If you're in that side of town, you'll go to Glendale. If you're in Scottsdale, see us. If patients are interested in this, they can go to our website, which is arizonapain.com. We talk about a lot of our research studies there and some of the different spinal cord stimulation techniques, and the phone numbers are listed there. It's really easy to make an appointment with us.
Well, the fact that you do research and the fact that Jeff shared his story, I think that's going to get to a lot of people. Thank you all for being on the show. And Jeff, thank you for sharing your story. And for more information about Arizona Pain Specialists, visit them on the web at arizonapain.com or call the number you see right there on your screen.